Hello and welcome to today's Care.com webinar, Passing the Turkey and the Torch, Senior Caregiving and the Holidays. We're thrilled that you're able to join us. My name is Lisa Robinson-Scheller, Director of Sales Marketing here at Care.com, and I'll be your moderator today. I'm happy to introduce the speaker for today's webinar, Jill McNamara, Supervisor of the Senior Care Planning Team at Care.com, which provides families with expert guidance, strategies, and resources to meet the individual needs of adults and seniors. Guided by her professional and personal experiences in senior care, Jill is extremely passionate about helping families and individuals navigate their care journey. Jill has her master's in social work, is a licensed independent clinical social worker, and a certified advanced social work case manager. Jill received her Bachelor of Arts degree in social work from Gordon College and obtained her Master of Social Work from Simmons College School of Social Work. Before we get started, a couple of housekeeping items. Feel free to send us any questions during today's session by typing them into the questions box in your GoToWebinar interface. We will do our best to address all questions in the Q&A portion of today's webinar. You will receive a copy of the deck along with the webinar recording within a day after today's session. Jill, I'll now hand it over to you.
Great, thank you, Lisa. And welcome everyone. I want to thank you all for joining today's webinar as we're starting to talk about preparing for the holidays. Now when you hear the word holiday, what thoughts come to mind? Maybe you think of family, or the word joy, or maybe excitement. For others, maybe the word stress comes to mind, or maybe even chaos. And today we're actually going to be looking at the holidays from a caregiving lens. Specifically, what do you do if you're visiting a loved one for the holidays and suddenly notice a concern? Do you address it in the moment and risk maybe mom being embarrassed or upset? Or do you just ignore it because the holidays can be a stressful time and maybe mom's just having an off day? Well, today we're really going to look at what are some warning signs that could indicate that there really could be cause for concern. We're going to talk about some challenges that caregivers might face, as well as strategies to support caregivers and help plan ahead to make sure that their loved one's needs are met. Now, the information in today's session really is meant as tools, and not everything will help every family, but really to keep in mind that the information and strategies and resources today are meant to support you going forward, because you don't have to do it alone, and we can help. So there's often a misconception that caregiving means providing hands-on care only. And caregivers, yes, can help with things like bathing and dressing. Caregivers also do a variety of tasks. Things like providing companion care, which is help with meal preparation, like housekeeping. Maybe taking someone to a medical appointment and providing other transportation to errands. Maybe you're an advocate for your loved one, communicating with their doctors and ensuring that they're getting the right resources and supports available to them. Maybe you're just mowing the lawn for a loved one or even collecting the mail on a weekly basis. All of this is considered caregiving. And what happens is that so many times caregivers don't self-identify and therefore aren't looking for supports to help them in their caregiving role. Caregiving can also happen at any point in life. I was not expecting to find myself in a caregiving situation when my father had a heart attack 2 years ago and required triple bypass surgery. But being the social worker of the family, my siblings quickly turned to me to figure out how are we going to support my dad. And we see so often that caregivers can also be isolated in the workplace. We don't necessarily like to talk about how mom has dementia or how dad's incontinent. And again, it can feel like a very lonely journey. But today we're really going to be talking about some strategies and supports for caregivers and really how to best help your loved one. So to start, we're actually going to have a quick polling question. This will help you determine what facts you may or may not already know about caregivers. So I'm going to read to you and show you 5 different facts, and then put up on the screen for you to decide which fact you think is false. Number 1, 80% of the care provided is provided by family and friends rather than paid caregivers. Number 2, if this is in fact true, the estimated cost of these unpaid caregivers is about $522 billion a year. Number 3, 6 in 10 caregivers are employed. Number 4, 90% of caregivers are female. And number 5, the average out-of-pocket cost to caregivers is about $5,500 per year. So again, which of the following of those 5 facts is false? And I'll let everyone take a moment to decide what they think. Well, it looks like we have a pretty close guess. We'll close the polls. I'll share that with you. To show that it was a toss-up between the out-of-pocket costs as well as caregivers being female. And in fact, the answer is actually that caregivers being female is false. In fact, 66% of caregivers are female, and people are often surprised to find out that this is the case, as we often expect that the female is the primary caregiver, and that's just not the case. In fact, as the millennial generation starts to take over as primary caregivers, it's anticipated that it will be 50-50 between genders actually in a caregiving role. So as you can see from these facts, that a lot of us are in caregiving roles and providing care even in addition to other responsibilities such as working or even caring for our families. And that with the 65 and older generation expected to double in the next 20 years, from about 563 million to 1.5 billion individuals, this is something that's going to impact nearly all of us. So with the holidays coming up, maybe you're starting to anticipate visiting family. You're going home and you imagine this picturesque meal where you get to sit and relax and really just spend that time with your loved ones. However, maybe this is more your reality. Holidays can be stressful in general, whether you're preparing a meal for a loved one or maybe you find yourself in an unexpected caregiving situation. You find out that something's not quite right with that loved one. This actually was the case for my family last Thanksgiving when we went to visit my uncle, who had been hosting Thanksgiving dinner for the past 20 years. However, when we arrived, my uncle could barely even get out of his chair to greet everyone at the door. During the meal, he barely ate any food and actually had to excuse himself early to go to bed because he was so exhausted. This was really an indicator to the rest of my family that something wasn't right, and really started to spur the conversation of, what do we do about this? And now when you see those concerns with a loved one, it can be scary. We don't know, is this a legitimate concern, or is this maybe just some stress with the holidays? Maybe you start to feel guilt. If only I lived closer or saw this sooner, something could have happened. Maybe we could have helped out. Or even, what am I going to do going forward? These can be difficult situations. And speaking firsthand by going through this with my own family, it is harder when it's your own loved ones. And so really, implementing the help of an outside professional can be a great way to figure out what's going on and come up with the right type of plan. So for example, aging life care professionals, formerly known as geriatric care managers, can be a great option to go into the home and help support families with figuring out a plan of care or even answering questions for loved ones. For those of you who have the senior care planning benefit, you have access to a team of care advisors who really specialize in elder care, and our master's level social workers can guide you through these elder care situations. Whether this is determining a plan of care for your loved one, or even developing strategies of how do you address these concerns and have that conversation. Really seeking out that professional support can help families extremely, because this is a difficult avenue, and navigating senior care can be really complex. Now, when you visit a loved one, there may be some warning signs that could indicate there may be a concern going on. But what's important is that you want to look for changes in baseline behavior. For example, when I visit my mother for the holidays, it's fairly normal to walk into a house of what we like to call organized chaos. The meal is, without a doubt, at least an hour later than we had planned. There's pots and pans all over the counters, and my mother is just cooking frantically, and again, her organized chaos. But now, if you're used to visiting a loved one, and for instance, actually my in-laws, where the meal is promptly served at 2 o'clock, you will not be late, and the house is impeccably clean with not a dish in sight, that's a different situation. And if I was visiting my in-laws and walked into the scene that I'm familiar with my mother, that would be cause of concern. So again, we want to look at what's a normal behavior, the organized chaos at my mom's house, versus is that really something different? It's not their baseline, and that should be cause for concern. So for example, maybe you drive up to visit a loved one. You notice that there could be some dents in the car that you haven't noticed before. Maybe you're looking at the yard and notice that it doesn't quite look kept like it normally does. Or you walk into the home and you're used to seeing that impeccably clean and organized picture in front of you. And the home and maybe even your loved one looks slightly disheveled. Again, these could be causes for concern. One of the most common reasons for hospitalization that we often see with individuals is misuse of medication. And this may be something that you'd want to figure out with your loved one. Are they taking their medications? Can you look in the pill boxes and see, is this something that they look to be managing? Again, you want to be looking for changes in their appearance, maybe with their mood, with the home in general, and also even with their judgment or decision making or cognitive skills, such as if your mother's made the same Thanksgiving pie for the last 20 years, but suddenly can't remember the recipe, this may be cause for concern. So again, see what's abnormal for your loved one, and that could show that there may be some concerns with their functioning. Challenges that caregivers may encounter as they're trying to get a handle on these concerns is that it's very easy for us to fall into old family conflicts. You're working with your siblings or other family members, trying to figure out what's really going on, and it's so easy to get caught up in those old dynamics. But it's important to really stay focused at the task on hand to really best support your loved one. And again, this is where having an outside professional can come in very useful to help keep the family on track, whether this is by having an in-person meeting or if you were talking to an advisor over the phone through a family conference call. All of this can help keep the conversation rooted and focused around what are your parents' needs. There's also something we like to refer to as the panic denial guilt syndrome. And what this means is that it's very normal for individuals when they start to notice concerns with a loved one to get scared. You don't know, is this a legitimate concern, or even panic around what are you going to do to help them? Oftentimes we can be in denial. As I said, maybe something's fine with my mom. It's just the holidays. This is normal stress. It's okay that she couldn't remember how to make this recipe she's been making for 20 years. But in fact, is that really okay? Maybe you then feel guilt that if I only saw this sooner, or if I lived closer, I could help her. And again, all of this is normal, but we want to stay focused on what your loved one needs. So don't get caught up in this cycle of the panic, denial, guilt. It's also very common for caregivers to forget their own needs. Caregivers are actually more likely to delay their own health screenings and are more susceptible to things like substance abuse and depression because they're often putting their own needs last. But in fact, if we're not taking care of ourselves, we're not going to be able to best care for our loved ones. And I know this is hard, and it's different for every individual. But trying to figure out how can you still care for yourself while caring for your loved one. Now, you've noticed some concerns. What do you start to do about this? Well, first it's important to really obtain information, more than just what you're seeing, to make sure that other people are on the same page. And maybe they have some concerns that you weren't even aware of. Talking with other siblings or family members who are involved in care, or if you have a release of information, a HIPAA form, to speak with a loved one's doctor. That can be another great way to ask, has this doctor noticed any concerns? And have they seen your loved one recently? Once you have more of this information and have a clear picture as to what's going on with your family member, that's when you can start to figure out a plan. Now, if you're the primary caregiver, whether a loved one is living with you or not, and you're taking on the majority of the responsibilities, it's also important to ask for help. And how many times have we been in a situation where maybe we've been sick or been going through a hard time, and somebody says to you, if you need anything, just let me know. And how many times do we actually take them up on that? Very few. And that's because that general offer for help can be hard. When we have a much more focused or specific offering or request, it can be much easier to actually follow through. For example, if your sister said, I know mom has a doctor's appointment next week, why don't I take her to that appointment since you've been going to all of the other appointments with her? You're probably much more likely to accept that because it was a concrete suggestion. And so many times we hear from families who we work with, maybe even if they're not the primary caregiver, that they want to help their sibling or other loved one, but really just don't know how. So I know asking for and accepting help is easier said than done, but starting by having concrete requests can be a great way to actually involve the help from others. At the same time, in senior care, we often say that our plans are etched in Jell-O. And that's because things change. We really need to be flexible because even if we have a plan in place, it doesn't mean everything's going to go to plan. And things can change so quickly in the world of senior care. And so it does require us to be flexible for those times that things didn't go according to plan. You may also want to consider maybe changing some traditions. For my family, as I mentioned earlier, where we go visit my uncle every year, this year we actually decided to go to another relative's house who recently moved into a new house a few months ago. And we were able to frame it as this would be a great opportunity to have a housewarming as well as Thanksgiving. And so my uncle was on board with that, so we could really see this new house that my other relatives were living in, and we were able to start this new tradition. Now we've talked a little bit about how it is important to plan ahead, because although we can start to address any concerns you currently have, planning ahead can also help minimize a crisis. And although we can't plan, of course, for everything, there are some things we can do ahead of time. So it's important to understand first what care options are out there. So often we hear from families that they say, I never want to go into a nursing home, and think that's the only option available. When in fact, sometimes a nursing home can be a great fit, but there are other options that we're going to go over to understand what's available for your loved one. It's also important to understand your individual's finances, how much care costs, and what are the different payer sources to cover this cost of care. Because in order to help stick with that plan, we're going to need to make sure that a loved one can afford that. We'll also review how to have some of these conversations with your loved one, because talking about some of this information, it can be difficult. And really planning ahead by, once you see the concerns, know what your loved one wants, how do you have that conversation and meeting to start to implement resources or move the conversation forward? So starting with knowing the options as a way to plan ahead. Well, for one, my grandmother was diagnosed with early Alzheimer's. She was living at home alone. Her husband had passed away a few years earlier, and she started to struggle with some of her daily living. We noticed that cooking was starting to become a little bit challenging for her, and she was starting to forget a few things. And so I have another polling question with, given that limited information, I want to see and get your sense of which of these 5 options would actually be the best fit for my grandmother with that situation. So I'll give everyone a minute to fill in which of these options do you think would best be able to support my grandmother. Okay, it looks like we have a majority of the responses, and I will actually show you what people thought. And the majority said that home care would be a great option. And in fact, this is kind of a trick question. So really, home care, adult daycare, and assisted living could be a great option for my grandmother in that stage of her life. And this is where senior care is challenging, because there are different options, and various options can support people at different stages and different care needs. And again, this is where involving a professional to help navigate the world of senior care can be really helpful. So first, with home care. Home care brings an individual into the home to help with the activities of daily living. Things like meal preparation, bathing, dressing, light housekeeping, all of those daily activities. And that could be a great option for my grandmother, because she could have somebody come in and help cook for her, where we were concerned with her maybe leaving the stove on. They also could provide transportation to help her do her grocery shopping and other errands. And so this was a great option to bring somebody into the home to really help her with these various tasks. Now, there are 2 types of home care, non-medical home care and skilled home care. And what I just referred to was considered non-medical home care. There is, in fact, someone can receive skilled care, or what's called Medicare certified home care, if they need some type of rehab or maybe IV after they've been hospitalized or maybe went to a rehab facility. But primarily what most families experience is this non-medical home care. Adult daycare can also be a great option for my grandmother at this stage of life, because these are programs where you can actually go and they provide socialization, they can provide skill building, and even medical care. And some of them are designed specifically for those with Alzheimer's and dementia. So that was also a great option for my grandmother, because she could go for a few days a week, a few hours a day, and sometimes, depending on the state, adult day programs may be more cost-effective than introducing 8 hours of home care. And assisted living is the third option that could be a great fit for her in this situation, because assisted living communities provide staff on site to help with those activities of daily living I mentioned, but it's also for individuals who still maintain a level of independence. So she could go there and have her meals prepared in the dining hall, and then if she needed help with other areas, such as maybe prompting for medications, or maybe she needed help with bathing once or twice a week, they have staff available who can help provide that type of care. A lot of assisted livings also have memory care programs, which are designed specifically to support individuals who have Alzheimer's and dementia. So next, my grandmother in this case actually utilized home care and adult day care. We combined the two for her. But as her care needs progressed, she started to need more and more care. And so it got to the point where she really needed 24/7 care. And so this is where a nursing home was a good fit for her, because the nursing home provided that around-the-clock care and that medical care that she really needed as her Alzheimer's progressed, and really she started to struggle with her daily functioning. And they could provide that help with bathing, dressing daily, administering her medications, and giving her that support because she couldn't be left alone because of the Alzheimer's. And finally, as we knew that her life was starting to come to a close, our family introduced hospice. And hospice is a widely underutilized program. And I know it can be difficult for families to even consider because it is acknowledging end of life. But what most families aren't aware is that hospice can provide support to an individual and their families for 6 months. Someone has to have a 6 months or less life-limiting diagnosis. So it's not just the last few days or few weeks of somebody's life. And what hospice does is they're a holistic wraparound service approach where you have not only a doctor and a nurse involved to help provide medical care for your loved one, but you also have a home health aide helping with some of those activities of daily living. You have a chaplain for any families who have spiritual and religious components and needs. You also have a social worker who can help the family with bereavement counseling after the fact and really just supporting them, making sure they have the needs in place to support their loved one in the family. And finally, you can also have a visiting resource, someone to come and just spend time with your loved one. Maybe if you're working during the day and you're concerned with them being home alone for those hours. And in fact, hospice is covered under Medicare. So this is a great support for families that it provides pain management and helps promote quality of life towards the end of life and really allows families to spend that quality time with their loved one. So this was something that was a great resource to my own family because it did allow us to focus more on spending that time with my grandmother rather than having to worry about and really coordinate all her care needs. Now, I briefly mentioned that hospice is covered under Medicare. And actually, payer systems can be very complex and even fragmented in themselves. And people often don't understand what will and won't pay for care. And now I'm going to briefly run through this because we could actually spend an entire hour talking about these other payer sources. So this is just meant to give you a glimpse into what are some of the options that might be available for your loved one. Medicare is a federal program for individuals who are 65 years of age and older, or for individuals under 65 with certain disabilities. And it's meant to provide a health insurance for them, covering things like hospital visits, doctor's visits, and even prescription drug coverage, depending on what type of plan you want to purchase. Now, it's important to know that when you turn 65, you don't automatically get Medicare. You do have to choose what plans you want. And they do, in fact, have what they call state health insurance counseling programs, or SHIP programs, or they might be called SHINE, depending on your area. And I'll show you a resource at the end to connect with them. But they have counselors who can educate families on their options and help figure out what Medicare plan is best for their loved one, all at no cost. Medicaid, which is different than Medicare, is for low-income individuals. And unlike Medicare, Medicaid will cover the cost of long-term care. Now, Medicaid is both a joint federal and state program, so some of the eligibility requirements do vary by state. And often families have to work with an elder law attorney to figure out Medicaid spend down, which is essentially spending down their money to make their loved one eligible, as well as what are the eligibility requirements in that state. So Medicaid will cover the cost for some in-home care if you have what are called home-based waiver programs. And also Medicaid is the leading payer of nursing homes, covering 2/3 of the cost of all nursing homes out there. So for those who have loved ones that may be running out of money or be low income, Medicaid may be a good option. And you may want to connect with an elder law attorney in your state to really find out if your loved one would qualify. And again, for those who have the senior care planning benefit, they can reach out to their care advisor for support, and we can find attorneys for you. Long-term care insurance is also another avenue to help pay for care. And this is separate than your typical medical insurance policy, because this is a separate policy designed to help cover the cost of long-term care that you have to purchase. Now, keep in mind that your age as well as your health when you purchase the policy will determine the cost. So for my grandmother, when she was 85 and diagnosed with Alzheimer's, there was no way an insurance company would sell her a long-term care insurance policy just because of her age and her recent diagnosis. But for those who have these policies, it's important to understand what's covered under the policy, as well as is there an elimination period, such as 30 to 90-day window where you may have to cover the cost of care before this policy kicks in. You also want to know if inflation is taken into account with this policy. And there are a lot of questions to ask to make sure that you can get the right coverage. And so again, reaching out to professionals or your care advisor for help navigating this policy will be important to figure out the best use of it. Veterans benefits is another avenue to help pay for care. Now, there are many different benefits out there, but the most common one you may have heard of is called the aid and attendance benefit, which is designed to specifically help individuals with their activities of daily living. Now, this benefit is income-based, so families can reach out to the Veterans Administration to figure out if their loved one is eligible for this, because a veteran who served during a war period can be eligible, as well as the surviving spouse of a veteran. So if you have a loved one who's a veteran, it's great to look into this option because you may have some additional funds to help pay for care. And finally, private pay, which is essentially your savings, is typically the primary way that families help cover the cost of care. Now, I want to briefly talk about how much care costs, because we're talking about the different options to help you plan ahead, as well as what will and will not pay for care. But how much is care in the first place? Well, care actually varies based on the level of care somebody needs, as well as your location. So for example, if you have a loved one living in Iowa, you're in luck, because Iowa is the cheapest state for care, with a nursing home only costing about $60,000 a year. Now, if you have a loved one who lives in Alaska, you may want to consider moving them, because the average cost of a nursing home in Alaska is $280,000 a year. And so really it's important to know what are the different costs in each area, because that will vary. I mentioned earlier that in some places, an adult day care program might be more cost effective than home care. And in fact, in Massachusetts, that's the case, where adult daycare may cost about $65 for the day, but the average cost for home care per hour is about between $24 to $26 per hour. So again, navigating this world of senior care is important because you want to understand first what supports are available to your loved one, how much they're going to cost, and what resources they have to pay for care. And again, I know this is a lot of information, so this is where we encourage families reaching out to professionals who are really experts to navigate this area and figure out what's available to your loved one. So you know these options, you know the cost, what will and will not pay for care, and you also notice some concerns with your loved one. What do you do next? Well, you want to talk about this. You want to have a family meeting, again, involving everybody who is part of the care and care plan for your loved one, whether this is a parent, spouse, grandparent, aunt, uncle. You want to bring everyone together to not only, again, address the different concerns people have noticed, but come up with a plan of how you're going to address your concerns with your loved one. Again, blurting out during Thanksgiving dinner of, "Mom, why can't you remember how to make this recipe? This is really concerning," probably isn't the best approach. We want to be strategic about this. So again, who should talk to mom about this concern and others that you've noticed? Can you involve a doctor to bring up the concerns about driving, or even make the suggestion about no longer driving? Healthcare professionals can be a great advocate if your loved one has a good relationship with them, because it can often take the pressure off of the family member and almost make that healthcare professional more, quote unquote, the bad guy. And I know as families it's hard to take on that role, and it's tougher when it's your own family. So if you can more support the recommendations of that healthcare professional, rather than maybe bringing up the recommendations yourself, for some families that can be a great approach. You want to also be sure to involve your loved one in the conversation and decision making. So many times I work with families where they may call up and say, "Okay, we have this great plan in place for my mom. We've noticed concerns with her. We found this assisted living community. We're going to move her there. We're going to sell her house. It's going to be great. We just need to get her on board." And then I stop and ask, "Well, what does your mom want?" Many times families haven't thought of this. And it's normal because we tend to be so solution focused and wanting to just get things done and kind of move on. But really, unless your loved one is proven incompetent, which can be fairly difficult to do, they have the right to make their own decisions, even if they make decisions that we don't agree with. So this is where involving them in the conversations and involving them in the process is so important. Because the more control that they feel like they can have, while at the same time trying to promote their independence, the more apt they'll be to really go along with what this plan is. And again, I know this is different for each individual. And we often work with families where they say, "My loved one is resistant to accepting help." And this really does require specific strategies for your loved one that a professional can help with. So if you haven't noticed concerns with your loved one, we talk about what's called the 40-70 rule, that if you're 40 or your loved one's 70, that's a good time to start talking about these things. In fact, often if your loved one's healthy, it can be easier to start to have this conversation, because a lot of this takes time. You're probably not going to go home for the holidays and say, "All right, Dad, we need to talk about your finances, what you want for care as you age, what we're going to do when you can't drive," and listing off a whole slew of topics, because that just generally doesn't seem to work very well. You want to be strategic. Who's going to talk to them? Who is the care team around to support your parents? And really, what do they want? Maybe what are their fears? Again, we hear a lot from people, "Don't ever put me in a nursing home." But do they know what other options there are? And we also don't want to make promises we can't keep. But you can express your concerns to them about what you've noticed, as well as talking about some more of those challenging topics like driving, which we often consider the nuclear warhead of senior care. And again, driving, finances, end of life, these can be difficult. And this is why a lot of this is ongoing conversations with families, because it's not something you're probably going to cover in one day. But coming up with that strategy of how you're going to have the conversation and then addressing these different topics is very important in supporting your loved one going forward. And throughout all of this, we've talked about the fear of finding concerns with your loved ones, maybe the challenges of working through your own family dynamics or even expressing your concerns to your loved ones. But we don't want to forget about the silver lining. There can be a lot of positives with caregiving. With my dad, I was surprised to find out just how much my siblings and I grew closer as we really worked together to come up with a plan of care for my dad. And we all took on different roles, but we really were able to work together in that situation, which was quite refreshing. Maybe with somebody, if you have a loved one with dementia, maybe you find a new sense of humor. My grandmother, who was always pretty quiet, got to be pretty feisty as her Alzheimer's progressed, and it was actually fairly funny for our family to engage with her, and she would laugh along with us, and we found this new sense of humor with her. We really want to, again, make sure we're cherishing that time with our loved ones and not only focusing on the challenges, but spending that time and really promoting the So as we're starting to wrap up, I do want to leave you with some resources going forward. One is the Medicare.gov website, which has a lot of great information on Medicare and even Medicaid. Now, to warn you, there is a lot of information on here, so it can be a little difficult to navigate, but a great resource nonetheless. The Veterans Administration is a great resource if you have a loved one who's a veteran, or maybe the surviving spouse is a veteran, and you want information on the various veterans benefits that might be available to them. The Elder Care Locator that is listed here is an avenue to find what's called your local area agency on aging, or council on aging. And what they are is a resource for individuals who are 60 years of age and older, and they know the local resources in a particular area. Things such as transportation options, Meals on Wheels, or as I mentioned before, those SHIP or SHINE counselors to help figure out what Medicare plan is best for your loved one. So you can go onto this website or call the phone number and they'll connect you with the area agency in your loved one's area. And finally, the Alzheimer's Association is a phenomenal resource for any families who have loved ones with Alzheimer's or dementia, or even those who are starting to notice some cognitive concerns. They have a 24-hour helpline. They can provide families with diagnostic centers to determine if your loved one has Alzheimer's and dementia. And they have a whole avenue of different supports, not only for the individual, but for the families and caregivers as well. So I would highly recommend, if you're not connected with them, to connect with the Alzheimer's Association if you have someone with Alzheimer's or dementia in your life. So before we get to questions, I want to leave you with a quote that I feel really encompasses the caregiving journey. And it says, "One person caring about another represents life's greatest value."
Thank you so much, Jill. We've received a number of questions from our audience members today, so let's address them now during our Q&A session. The first question is, my parents are in their 90s and have all the warning signs. The problem is that they're in complete denial. They say they don't need help. My mom gets upset. Siblings are out of the picture. Where do I start?
That is difficult, but it is so normal. We work with families all the time, and we hear this. And the reason why we see so much resistance is that it can really feel like when individuals acknowledge there's a problem, that they're starting to lose control, and they're starting to lose independence. And control and independence is so important to us. So really the best way to start with individuals, we say, is trying to align with them. First, figuring out what your parents want, starting this conversation. And again, these things take time. And so figuring out, well, what do your parents want? Is it if they want to stay in the home, how can we then bring in supports that aren't taking away from their independence, but supporting those wishes with helping them remain in place? This is, I know it's a lot easier said than done, and actually this does take a lot of planning and strategy. And so this is where we would encourage for families who have the senior care planning benefit to contact a care advisor, and we can develop an in-depth strategy and really talk about specifics for your family. And if you don't have the benefit, you may want to consider hiring an aging life care professional, formerly geriatric care manager, to really start to help navigate this plan. Because when you're working with resistance, there's no fast solution. And so really it's an individual strategy for each family to figure out how do we get them to get on board with these supports.
The next question is, these examples are pretty extreme. How large a change should be a baseline for concern?
So again, I think this is specific to each family, figuring out what your baseline is. And going from there to see, is there also a pattern? You know, if you get home and you notice one thing is out of place with your parents' house, that may be something out of the ordinary, but are you seeing more of a pattern? So you want to just keep in mind what is the norm for your loved one, and then start to notice, are there any concerns? You'll also want to probably talk with other family members, whether it's siblings or other loved ones, to see if they've noticed anything as well. Because if multiple people have noticed even minor concerns, if there's a pattern, there's likely something going on. And you may not need to necessarily implement supports right away, but it's a great way to even start this conversation.
The next question is if you could repeat the name of the Veterans Benefit.
Sure. So the name of the Veterans Benefit that helps with the activities of daily living is called the Aid and Attendance Benefit.
My parents don't have a lot of money. How do I find out if they qualify for Medicaid where they live?
So as I mentioned, Medicaid is, it does vary by state since it's a joint federal and state program. So really the best bet is, one, you can actually contact your local area agency on aging through the elder care locator that I had up in the slide before. And oftentimes they have social workers on staff who can help answer some general questions on Medicaid. But really the best bet is probably connecting with an elder law attorney in the state where your loved one lives. Because if you work with an attorney who specializes in Medicaid, they'll be able to give you more specifics around eligibility requirements. And if your loved one is over income, they'll go through what's called Medicaid spend down, where essentially they will help put money in different places so that your loved one will eventually be eligible. And one important thing to note with Medicaid is that there is a look-back period. It varies by state. We've seen anywhere from 3 to 9 years in which Medicaid will look at any assets or funds you've transferred during that time, and they will count that as part of your income. So this is where, again, it can get fairly complicated. So it's important to really connect with an elder law attorney, or if you think your loved one is eligible already, you may want to contact the area agency on aging as a place to start.
Is hospice arranged through the nursing home?
Hospice can be arranged through a nursing home. You do typically need a doctor's orders, but if hospice can actually go to a nursing home and provide services in the nursing home. It can provide services in the home, and sometimes there are even hospice homes where your loved one can actually go and live. But keep in mind, when I say that Medicare covers hospice services, it covers the services provided by the team. It does not cover room and board. So in a nursing home, you'd still be paying the cost of the room and board, and then hospice, you wouldn't have to pay for that care because it's under Medicare. But you can absolutely, if you have a loved one in a nursing home and you think that hospice is something they may be eligible for, you can talk to their doctor, talk to the nursing home, and they can connect you with a hospice. Or again, if you have the senior care planning benefit, our team can actually find you hospice options as well.
Do you have more details on a HIPAA form needed to talk to a family doctor?
Sure. So the HIPAA form is that release of information, which your loved one would sign, and on the form they would indicate who can speak with the doctor. Now, if you don't have this signed, you can still call the doctor or the nurse practitioner, express your concerns, but they won't be able to engage in a conversation back with you. Now, typically, you have to get a HIPAA form signed by every healthcare professional because they do want to see it actually signed by your loved one. Now, we recently learned that in about 13 different states across the country, there's grant programs to develop this universal information release form so that families don't have to obtain it from all the different doctors. This is still fairly on in early stages, so it is something that we're hoping within the next year to few years they'll have this universal release so you don't have to go to each doctor, but currently you do have to go and have that signed by each individual doctor, and they keep it on file at that office.
Why do nursing homes not want to take Medicaid patients if Medicaid funds most of the care?
So when I say Medicaid funds most of the care, they do cover 2/3 of all the people who are in nursing homes. The challenge, though, however, is that Medicaid, the reimbursement rate to cover the cost of someone in a nursing home is far less than what you would pay out of pocket. So this is where a lot of nursing homes, you do run into that challenge with wait lists often for Medicaid beds, because if somebody pays privately, the nursing home is getting a lot more per day for that person than it for somebody who Medicaid is covering. So this is the challenge if Medicaid's involved, and often with families, you know, if they can get a loved one into a nursing home while they still have private pay funds, it may be easier and you may still have more choice. But if you're moving in strictly under Medicaid, you are likely going to run into wait lists, and you'll likely have fewer options of places that accept Medicaid. So it does get tricky. It is an unfortunate reality, but this is, again, where professionals can really help guide you with figuring out what nursing homes are available to you.
My mother and I help care for my aunt since she doesn't have any children of her own. We have both noticed some concerns with her memory over the past 6 months, but aren't sure what to do about it. Where do we start?
So this is tricky because, again, noticing concerns with memory, it can be a challenging one. And actually, in fact, what we see is that a lot of times when individuals start to struggle with their memory, they're aware of it. And people can be really good about hiding this. For example, I worked with one family where the mother had trouble remembering when she was cooking and would keep her oven mitt on the entire time something was in the oven to remind her to keep checking and make sure that she didn't burn it. So memory can be tricky, but really a good place to start is that we want to have both a medical and cognitive evaluation, because sometimes issues that look like they could be memory concerns could in fact maybe be treatable medical conditions, such as maybe an untreated urinary tract infection. So a good way to start is really suggesting a normal medical checkup. And you can tie in the cognitive evaluation into that, saying, you know, this is a normal part of aging. And again, if you have a cognitive evaluation, you want to make sure it's with somebody who specializes in geriatrics, because not all primary care physicians are skilled in knowing exactly what to look for. And as I mentioned before, people can be fairly good at hiding this. So this is where the Alzheimer's Association can be a great help in providing families with diagnostic clinics. So you can go to the primary care, have the medical eval, and then also go to the diagnostic center and have that cognitive evaluation. Because once we know what's going on, that's when you can start to come up with a plan to best help your loved one.
So we have time for one more question. I've had to take quite a bit of time off from work to help my mother, who has some severe medical issues over the last few months. I've just about used up all of my sick and vacation time taking her to various medical appointments, and I'm not sure what I'm going to do after that. Any suggestions?
Sure. So we do find that a lot, that caregivers, it's challenging balancing work and caregiving because caregiving doesn't stop when you get to work. Now, a few options again. Are there any other family members or friends who can take mom to those medical appointments? Maybe you want to consider hiring a caregiver to do so that you're not taking the time out of work. Maybe you have a backup care benefit that can provide that transportation to mom. Or if it's really important that you're there and that's the only option, you may want to talk to your HR to find out if you qualify for the Family Medical Leave Act. And this is for eligible employees. And what you receive is that you can have up to 12 weeks in a 12-month period of job-protected unpaid leave. And so for a lot of families we work with, they may need to take some time off of work to really help manage their loved one's situation, and that's okay. And you may want to look into this FMLA, the Family Medical Leave Act, if that's your situation, to see if you're eligible for that service.
Well, that's about all the time we have for today. From all of us at Care.com, thanks for joining us. We'll be making the webinar recording and the slide deck available. We'll get that out to you in the next day. And want to wish all of you a wonderful holiday season. So long.